Hello and welcome to Dr. Mark Hyman Official. I'm Dr. Mark Hyman, a medical specialist with 10 years of experience. Please subscribe, follow, and support the channel. Today's topic is 5 red flags your doctor is rushing your appointment. Let's get started. Healthcare visits are meant to be collaborative, thoughtful, and centered on your well-being. While medical professionals often work under time constraints, you should never feel dismissed, unheard, or hurried through concerns that matter to your health. Today, let's talk about 5 red flags that may suggest your appointment is being rushed, and why recognizing them is important. First, you're interrupted within seconds of speaking. Studies show that patients are often interrupted very quickly after they begin explaining their symptoms. If you barely start describing your concern and the conversation is redirected or cut short, that may signal your provider is focused on speed rather than understanding the full picture. Second, there's little to no eye contact or engagement. If the clinician spends most of the visit typing, looking at the clock, or standing near the door, it can feel transactional rather than attentive. While documentation is necessary, meaningful listening requires presence and engagement. Third, your questions feel brushed aside. If you ask for clarification about a diagnosis, medication, or side effects and receive rushed or vague responses, that's a concern. You deserve clear explanations in language you understand. Healthcare decisions should feel collaborative, not one-sided. Fourth, no physical examination when one seems appropriate. While not every concern requires a hands-on exam, completely skipping it without explanation, especially when symptoms are physical, may indicate haste rather than careful evaluation. Fifth, you leave feeling confused or unheard. Perhaps the most important red flag is how you feel afterward. If you walk out unsure about your treatment plan, unclear about next steps, or feeling like your concerns weren't fully addressed, the appointment likely lacked adequate time and attention. Time pressure in healthcare is real, but your health concerns are important. You have the right to ask follow-up questions, request clarification, or even schedule another appointment if needed. Effective care relies on communication, trust, and partnership. Remember, a good medical visit isn't just about efficiency, it's about understanding, clarity, and thoughtful care. Your voice matters. Frequent interruptions during a medical appointment can be an important red flag because they interfere with your ability to fully explain your symptoms and concerns. When a patient begins describing what they are experiencing, those first few moments often contain essential details. Symptoms may not always follow a neat or predictable pattern, and subtle information can provide valuable diagnostic clues. If you are interrupted within seconds, the full context of your condition may never be communicated. Interruptions can also make patients feel dismissed or undervalued. When someone gathers the courage to discuss pain, discomfort, or personal health worries, being cut off can create frustration or hesitation to continue sharing. As a result, you may leave out important information simply because you feel there is no time to speak. This can lead to incomplete assessments or misinterpretation of your symptoms. From a clinical standpoint, listening without interruption allows patterns to emerge. Patients often reveal associated symptoms, timelines, triggers, or concerns naturally when allowed to speak freely. When the conversation is redirected too quickly, perhaps toward a diagnosis or prescription, the opportunity for a thorough understanding may be lost. It's important to recognize that healthcare providers often work under time constraints. However, effective communication does not always require long appointments. It requires focused attention during the time available. Even a brief period of uninterrupted listening can significantly improve clarity and trust. If you notice frequent interruptions, it can be helpful to politely say, "I have a few more details that might be important," or "May I finish explaining the timeline?" Advocating for yourself ensures your concerns are fully heard. Clear communication forms the foundation of accurate diagnosis, appropriate treatment, and a stronger patient-provider relationship. Lack of engagement during a medical appointment can be a subtle but meaningful sign that the visit is being rushed. Engagement goes beyond simply being present in the room. It involves active listening, eye contact, attentive body language, and thoughtful responses. When a clinician spends most of the visit focused on a computer screen, typing continuously without pausing to acknowledge what you are saying, it can create a sense of distance. While electronic documentation is necessary in modern healthcare, it should not replace meaningful interaction. Eye contact plays an important role in communication. It signals that your concerns are being heard and taken seriously. If the provider rarely looks up, appears distracted, or seems preoccupied with time, you may feel like your symptoms are secondary to administrative tasks. This can discourage open discussion and reduce your comfort in sharing sensitive or detailed information. Body language also matters. Standing near the door, frequently glancing at the clock, or appearing physically turned away from you can unintentionally communicate urgency or impatience. Even if the medical advice given is accurate, the experience may feel impersonal and transactional rather than collaborative. Effective healthcare depends on trust. Patients are more likely to follow treatment plans and share important updates when they feel respected and understood. Engagement fosters that trust. A few moments of focused listening, clarifying questions, or summarizing what you've said can make a significant difference in the quality of the visit. If you sense limited engagement, you can gently ask, "Do you think this could be related?" Or, "I'd appreciate your thoughts on what I'm describing." Encouraging dialogue helps shift the interaction toward collaboration and ensures your concerns receive the attention they deserve. Questions should never be dismissed during a medical appointment because asking questions is a vital part of understanding your health. When you seek clarification about a diagnosis, medication, side effects, or treatment plan, you are taking an active role in your care. If responses feel rushed, vague, or overly technical without explanation, it may signal that the conversation is being hurried rather than fully addressed. Clear communication is essential in healthcare. Medical terminology can be complex, and without proper explanation, it's easy to leave an appointment confused about what a condition means or what steps to take next. If a provider responds with short answers, quickly changes the subject, or implies that your concerns are minor without discussion, important information may be missed. You deserve to understand why a test is being ordered, how a medication works, what side effects to watch for, and when to follow up. When questions are brushed aside, patients may feel hesitant to ask more. This can create a one-sided dynamic where decisions feel dictated rather than shared. Effective healthcare works best as a partnership. Shared decision-making ensures that treatment plans align with your preferences, lifestyle, and comfort level. Dismissed questions can also impact safety. For example, understanding potential drug interactions, warning signs, or alternative options is critical. Without that clarity, you may struggle to follow instructions correctly or recognize complications early. If you sense your questions are being minimized, consider saying, "I'd like to understand this better," or "Can you explain that in a bit more detail?" Advocating respectfully for clarity encourages open dialogue. A thorough medical visit includes time for discussion, ensuring you leave informed, confident, and prepared to manage your health responsibly. Skipping a necessary physical examination can be a sign that an appointment is being rushed, particularly when your symptoms are physical in nature. While not every concern requires a hands-on exam, there are many situations where observation, palpation, listening with a stethoscope, or basic neurological checks provide valuable diagnostic information. If these steps are omitted without explanation, it may leave important details unassessed. A physical exam often reveals findings that cannot be captured through conversation alone. For example, swelling, tenderness, abnormal heart rhythms, skin changes, joint limitations, or subtle neurological signs may only become apparent during examination. Even simple actions such as checking blood pressure, listening to lung sounds, or examining the abdomen can help confirm or rule out potential causes of symptoms. When these steps are skipped, the evaluation may rely too heavily on assumptions. In some cases, providers may determine that a physical exam is not necessary based on your history and symptoms. However, when that decision is made, it should be communicated clearly. A brief explanation such as, "Based on what you've described, an exam isn't required today," reassures you that the choice is intentional rather than rushed. The absence of examination can also affect patient confidence. Many people expect at least some level of hands-on assessment during a visit for new or worsening symptoms. Without it, you may feel uncertain about how thoroughly your condition was evaluated. If you believe an examination would be helpful, it is reasonable to ask, "Would it make sense to examine this area?" or "Should we check that today?" Open communication helps ensure that nothing important is overlooked. A thoughtful clinical assessment balances history, examination, and testing to provide safe and comprehensive care. How you feel after a medical appointment can be one of the strongest indicators of whether it was rushed. If you leave feeling confused, unheard, or uncertain about what happens next, it may suggest that there wasn't enough time devoted to clear communication. A well-conducted visit should provide clarity about your diagnosis, treatment plan, and follow-up steps. You should understand what symptoms to monitor, when to seek further care, and how any prescribed medication should be taken. Confusion often arises when explanations are delivered too quickly or without checking for understanding. Medical information can be complex, and absorbing it in a short period of time is challenging. If no summary is provided at the end of the visit, or if you are not invited to ask final questions, important details may remain unclear. This can lead to medication errors, missed follow-up appointments, or delayed responses to worsening symptoms. Feeling unheard is equally significant. If your concerns were minimized or not fully explored, you may question whether the underlying issue was properly addressed. This can erode trust and make you hesitant to return for future care. A strong patient-provider relationship is built on mutual respect, careful listening, and reassurance. Uncertainty about next steps can also create anxiety. You should know whether additional tests are needed, when results will be available, and who to contact if problems arise. Without this information, you may feel left to manage your health alone. If you walk out with unanswered questions, it is appropriate to contact the office for clarification or request a follow-up visit. Healthcare works best when patients feel informed and supported. Leaving with confidence and understanding is a key measure of a thorough and attentive appointment. Thank you for watching Dr. Mark Hyman Official. If you found this video helpful, please like, subscribe, and share it with others. Your support helps us create more valuable health content. Stay healthy, stay informed, and I'll see you in the next video.